So good afternoon, good morning. Thank you for joining us today. Thank you to the panel, thank you to our specialists, and thank you for those who are attending from home or from work, watching us on YouTube. This is the Parents Project Final Conference. Unfortunately, the event will be broadcast live on YouTube. Despite 1 year ago, we were hoping to host an in-person meeting and share the main results and live this day together face-to-face, but it's not possible yet. We'd like to thank the specialists invited to join us today and comment parts of our work under the Parent Project. The project was launched in early 2019, and it means promotion, awareness, raising, and engagement of men in nurture transformations, and it aimed to tackle the challenges of prevention and eradication of violence against women and children by engaging men in co-responsible parenting and caregiving, and also promoting an equal share of unpaid care work. The project was co-funded by the European Union's Right, Equality and Citizenship Programme and through partnerships with local organizations in 4 European Union countries: Austria, Italy, Lithuania, and Portugal. Several activities and awareness-raising campaigns were developed to promote changes in social attitudes and behaviors regarding gender roles in caregiving. And as the project wraps up, the final conference brings together the various local delivery partners and external guests to reflect on results, lessons learned, and ways forward. Let me start by introducing the first panel and myself. I'll be the MC of this conference, but I'm also a researcher of the project. My name is Tatiana Moura. I'm from the Center for Social Studies at University of Coimbra in Portugal. I also coordinate Promundo Portugal. And basically I've been working and doing research on masculinities for the last 20 years. I worked as the executive director of Promundo in Brazil, where I started to learn how to promote and adapt these gender transformative methodologies that partially inspired the work under parents, and also sharing some lessons learned from the State of Europe's fathers and some research we conducted in Portugal. We have our colleague Linda Cerdeira. Linda, she is a researcher at the Center for Social Studies, where she's doing her PhD in feminist studies at University of Coimbra. She's a researcher also of parents, and she holds a degree in international relations with a specialization in human rights. And from 2013 to 19, she was the program coordinator of Instituto Promundo in Brazil. And she's also a consultant in an international project called Global Grace, Global Gender and Cultures of Equality, and the Linea Project, Learning Initiative on Norms, Exploitation and Abuse. She has 15 years of experience in social, cultural, and gender projects in Portugal and Brazil, and she has coordinated several research action projects using gender transformative methodologies with a focus on masculinities. We also have Marisa Matias from the European Parliament. She's a sociologist. Thank you, Marisa, for joining us. She's a sociologist and currently a member of the European Parliament, elected for the first time in 2009, where she is the vice president of the GUE and NGL group, now called The Left, and a member of the Bureau. She serves on the industry research and energy committees as a coordinator, the Foreign Affairs Committee, and the Subcommittee on Human Rights. She's also a member of the new Committee of Inquiry on the Protection of Animals during Transport. She's a member of the Delegation for Relations with the Maastricht countries, the delegation to the Parliamentary Assembly of the Union for the Mediterranean, and the Delegation for Relations with Palestine. She's a member of the DEG, Election Support Coordination Group. Marisa also, via the Left group, co-supported the research on the state of Europe's fathers, also part of the Parent Project. So let me start by also welcoming our colleagues from the nursery school. Here we have Cristina Verissimo and Maria Neto, partners of the project in Portugal, and also Luisa Filipe. Thank you also for these 2.5 years with us of joint work. So Linda, the floor is yours.
Thank you. So I will now share my screen. Thank you, Tatiana, for a kind presentation and welcoming. Okay, so I expect that everyone is seeing my screen now. Okay. Take this from here. Sorry, I'm not a specialist on this. I'm sorry, I'm trying to see how can I take this from here. Okay. Sorry. Okay. Okay, so first of all, I'd like to introduce you a little bit of why care matters in a global perspective. This year, we have also the recently launched the State of World Fathers, launched by Promundo US and Mencare. And this global report tells us that regarding care and fatherhood in 2021, about the average time spent on unpaid care work, women worldwide still exceed the time spent by men by 3 times plus. When we look at girls and boys, girls spend 3.5 times plus than boys in unpaid care work worldwide. When we look at the number of countries that have achieved equality in unpaid care work, we find none of countries that have achieved this equality. The same to the number of countries that have a specific policy goal and target date for achieving this equality between men and women regarding unpaid care work. When we look at the state of paid parental leave, we find 115 countries that guarantee a paid leave exclusively for mothers, 71 countries that guarantee paid leave for fathers, and less than 20 countries in the world guarantee paid leaves for the same-sex parents. So basically, the global median days of paid leave for mothers worldwide is 98 days, and for fathers, only 5 days. So now go to Tatiana.
So the State of Europe's Fathers, and focusing on the work that we conducted last year, but based on data available since 2016, without a specific focus on the impacts of COVID, but also including some findings. The main objective of the State of Europe's Fathers was to contribute to theoretical and policy approaches that understand how gender equality, including caregiving, constitutes a collective social good to be promoted in general and in particular in times of crisis, and develop an evidence-based and detailed roadmap for social policies toward gender equality and men's greater participation in caregiving. By taking into account the current state of the art of gender-based violence prevention and gender justice, this report focused on concrete strategies for promoting gender equality in Europe and the engagement of men in caregiving and unpaid care work as a way to prevent gender-based violence and promote healthy and more equal gender relations. So we based our recommendations in 5 key areas for change that were systematized, summarized in the last State of the World's Fathers by Promundo US. And when discussing Europe's fathers, we recognize the plurality within families and across contexts. However, there are certain patterns that can be observed from modern caregiving practices within families. We consider informal caregivers as people who provide unpaid caregiving or care work to fulfill the physical and emotional needs of others, normally children, the elderly, or people with disabilities. And we know that although both men and women can be caregivers, rigid traditional gender norms have normalized women as the natural caregivers and promote the unequal distribution of unpaid domestic and caregiving work. So we propose 5 key areas, we and Promundo propose 5 key areas for change, implementing laws and policies to promote gender equality, transforming gender norms that reproduce harmful gender stereotypes, supporting the physical and financial security of families, helping couples and co-parents thrive together, and putting father's care into action. So under the research and data analysis carried under this report, we see that an equal distribution of caregiving responsibilities is a barrier for women's economic empowerment. 32.2% of women who weren't active in the formal economy said they could not be employed due to having to take care of their children, and only 4.5% of men reported this reason. And as you can see in this slide, in every EU country, women spent on average at least 10 hours more per week than men caring for children, and 18 hours more per week than men in domestic tasks. And yet, approximately 1/3 of heterosexual couples in the EU affirm that they do equally share unpaid care and domestic work in their households. This suggests that it is possible for at least some couples to organize their work and home lives in a way that enables equal sharing. Further, the overall EU average masks variation in the gender division of care across countries. Higher proportion of couples report equal sharing in Finland, Sweden, Slovenia, Spain, and Latvia. The caregiving gender gap does not go unnoticed by women, as you can see by this slide. Over 75% of women perceived that they spend more time on childcare than their partners in 7 countries. But when looking at the percentage point difference between men and women regarding who does more caregiving work, we saw the largest differences in countries like Slovakia, Czech Republic, Latvia, Greece, Austria, and Bulgaria. However, data suggests that men may not realize the extent of this imbalance. When asked to compare their time spent looking after their children with the time spent by their partners, as you can see on the right side of the slide, in most countries, a greater proportion of men reported doing the same amount of caregiving as their partners, despite the fact that in every country, women spend more hours a week on caregiving.
So these findings of this report show that gender divisions of caregiving roles still persist in the European Union, but Promundo proposed 5 key areas for change for moving towards the goal of men doing at least 50% of the unpaid care work in home. And we are now going to look in which these 5 key areas can work. So the first one that we propose is laws and policies. European Commission's 2017 communication on the initiative to support the work-life balance points out that one of the main reasons for the existing employment gap between men and women is the unequal distribution of caring responsibilities between them. So this inadequate work-life balance policies can discourage men from taking leaves and more flexible working arrangements, and it pushes women to reduce working hours in order to undertake unpaid care work. This obviously results in lower salaries, higher concentration in part-time work, and career gaps for women, which fosters economic dependence on their partners or the state and puts many women under an increased risk of poverty and social exclusion. As you can see, parenthood decreases the average employment rate of women, but it increases the rate of men. This graphic also shows that this inadequate work-life balance policies exacerbate this problem. Regarding parental leaves, as of 2018, all EU member states offered paternity and/or parental leave after the birth of a child, but there is a lot of variation across countries in the leave length, compensation levels, and whether leave is treated as a family or individual right, transferable or not transferable. Many studies also show that individual, non-transferable and well-paid leaves increase uptake by fathers and their engagement in care work, while low or no compensations result in lower leave uptakes by fathers and increases the chance of mothers leaving the job market. Some of the most successful schemes in European countries are based on individual, non-transferable, and moderately well-paid leave for both the mother and the father. In Sweden, as an example, each parent can take up to 240 days of paid parental leave, and which of them 90 days are non-transferable. Also, policies must protect parents from discrimination for taking leave. The discrimination is a major problem for new parents. The Danish Institute of Human Rights found that 45% of women and 23% of men who took parental leave experienced discrimination after taking the leave, and that 12% of women and 20% of men took less parental leave as they would have liked. Regarding the flexible work policies, as an example, the Portuguese legislation allows parents that have children up to 12 years old to opt for part-time or flexible work, and parents of children up to 3 years old to work from home. And these flexible work policies should be aimed in the national legal provisions. Other policies approaches to achieve better work-life balance should be accessible, affordable, and high-quality childcare, which is important as an instrument to achieve a better work balance and helping men to engage in more caring responsibilities. Also, public awareness campaigns that have been shown important impacts and an important role in raising awareness and encouraging fathers to take leave. And collecting data on paid care work and time use, which is also a critical tool to inform policymaking and budgeting the decisions that will influence work-life balance and gender equality. The second key area is regarding social and gender norms. So women are still expected to be caregivers and men are expected to be breadwinners. The existence of a legal framework that supports gender equality is necessary foundation for the advancement of women's rights at home, work, and society. However, this mere existence of laws and policies, it does not itself guarantee gender equality if they are not supported by the prevailing social norms or shared expectations regarding what is considered normal or appropriate behavior among the members of the group. Parental leave can play an important role in promoting social change. So men and women are obviously, as we know, socialized from birth to believe that there are certain ways to be a man or a woman. And this figure shows the percentage of men and women who agree or strongly agree with gendered statements. And for every statement, the differences in attitudes were significant by the respondent's gender. There are statistically significant differences between men and women's work-life priorities. Men were more likely to consider work very important to their life than women. And these norms have real-world impacts for both men and women. So men feel greater pressure to fulfill these expectations, may have more problems with depressive symptoms, fear of appearing vulnerable, or more easily turn to the use of violence. And across the European Union, women feel that they spend more time in childcare than their partners.
So key area for change number 3, economic and physical security of families. And for sake of time, we're going faster. Sorry for this. Pressures on men to provide financial and physical security can, of course, have negative health effects like mental health problems, smoking, being sedentary, gender spillover effects of men's unemployment, and unhealthy and unrealistic workloads. Economic pressures can, of course, be a barrier to men's caregiving, for example, by reducing childbearing intentions, promoting their reluctance to take leave, and family-friendly company policies don't reach all families, of course. Regarding masculinity or masculinities and caregiving in times of COVID-19, we saw and we see patriarchal discourses in policy responses that led to catastrophic answers and to the pandemics, the increase of men's violence against women, and precarious employment and unemployment. And we will still see the impacts during the short and medium future. Key area for change number 4, couples and co-parents thriving together. We know that relationships between co-parents are greatly affected by and impact caregiving roles. In turn, the quality of these relationships impact children. And we need to consider that in every research and strategies developed by our programs and projects. Key area for change number 5, transforming father's care, one of the main focus of our parent project. Build parents' confidence and competence through curriculum focused on fathers and caregiving. For example, the program P by Promundo, Parent by this consortium, Papa clubs or father groups, or the methodologies developed by the Fatherhood Institute and other colleagues in Europe and all around the world. We need to begin early by transforming gender attitudes of youth, by combating gender stereotypes at early ages, prevent gender-based violence, and we included an example of a previous EU-funded project developed by other consortium called EquiX, engaging youth at promotion of non-violent and equitable masculinities. And professionals may serve as gatekeepers to men's participation in childcare, mainly and under the scope of this project, healthcare professionals, social workers, and early childhood education and care specialists. So major main conclusions and recommendations. Disparities in women and men's caregiving are neither natural nor unchangeable. And in the context of COVID-19, we face urgent social and economic concerns, but also opportunities to accelerate change towards equality. And the benefits of gender equality are extensive, and the responsibility is everyone's. Thank you so much. Okay. Marisa? So sorry. Marisa?
Yes, I'm here. The connection is not so good, which is great because we are dealing with all digital regulation, so it's okay. Okay, thank you so much, and thank you, Tatiana and Linda, and also let me say hi to Maria Neto and to Cristina, especially because we were neighbors as kids, so I miss you. But just to say that I do apologize because I was a little bit late, but I have several meetings overlapped, and I just want to first of all say that this is a key project, not only to understand what's happening in Portugal, but also in Europe. And so I'm going to make my comment, of course, on the side of policy decision making and the reason why we got engaged, and also to comment a little bit on these results, but I'll be short. Just to say that this is really crucial for our work, and this is one area that we really need the most to have more and more research and to understand, because there's a lot of measures that we need to take and policies to be defined, and we are still really, really behind the needs. Uh, we know, and I know very well the work of Tatiana and Linda and the other members in these issues. And the reason why we decided to get engaged with this engaged fatherhood was because of the COVID-19 pandemic crisis. So we all know that we still have a very, very difficult situation when it comes to gender inequality. And we know also that gender inequality is not the outcome of a natural disaster or God's will. It's the outcome of centuries of cultural practices, but also of the fact that we don't have the policy measures that we need to take in order to fight the gender inequality and to promote proper fatherhood together with motherhood. So with the COVID-19 pandemic, we thought it would be really important to have more data on these issues and these dimensions because of several reasons, but basically because of the fact that we knew and we all know by now that the pandemic crisis and all the measures which were taken would challenge a lot the work-life balance, and we could be facing uh, even more difficulties to deal with the fight against inequality and to promote specifically the work-life balance. We saw there were a lot of changes in family dynamics, and we saw also how women were much more affected by the pandemic crisis than men, because they were more affected in terms of unemployment, because they are also in all the European countries and in Portugal in particular, because if you look to the figures, they are in fact in positions, in job positions, work positions, which are the most precarious in the work relations. So we would need to know it better in order to try to better answer also to these new challenges and avoid stepping back in this domain, which was and still is a huge risk in this new configuration of our life. So understand men's caregiving became even more central for us in our political activity and our need to have, as I said, much more information in order to take action. As we know, the caregiving and the domestic work are very unequal distributed, and as the project shows and helps us to understand, there are proper reasons why that happens, and and it's for us a key element to fully understand those proper reasons in order to try to define policies which will reduce the burden on women and will try to increase the equality in these domains. We don't have the capacity, and I'm sorry if I'm doing this comment based only in the policy decision making, but honestly, I don't have the arrogance or even the capacity to make a discussion as a researcher or fully aware of all the dimensions of the work. So I'm making the comment on the basis of what is the link between this project and also why we did get engaged, and as European Parliament, we asked for the development of this study. Because in this moment, we are still dealing with a lot of legislation that is blocked, namely when it comes to the legislation on maternity and paternity leave. I'm pretty sure that you are aware that this is a key element for the debate that we are having and for this study. And it's more than 15 years that this legislation is blocked at the European Union. We cannot come to an agreement. And so it was really key for us to have more information about these dimensions in order to propose proper legislation and advances in this area. Also, when it comes to paid leave, we have several different models across Europe. And in Portugal, we are still behind also in this area. So it is really important to know how to deal with it. Also, when it comes to wage inequality, for the proposals that we need to deal with on these. We know that the wages inequality is a key element which blocks the possibility of engaging the fathers in a more proper way, in the sense that the work and life balance can be achieved. And also, of course, another dimension has to do with public services, because we need the proper infrastructures, we need the proper measures in order to guarantee that also when acting in the work life, men and women can have the public services that are needed in order to guarantee, as I said, that possibility. These were our main uh, uh, areas of interest when we asked for this study. Of course, the outcome of the study goes much beyond our needs, fortunately, so we still have much more areas to work on as a result of the study. But I do think that with this cooperation between the academy and the research teams in these specific areas, that we can have the proper ground to make sound legislative proposals and policy proposals. So I basically want to thank the work which was done, to thank the presentation which was made, thank everyone who worked on this, and to say that this is exactly the type of research that we need in order to make proper policy making. Of course, it takes also engagement from our side. It takes also from our side to have a non-neutral position on this. And I have to say that from my group and the parliamentary group, of course, we have a feminist stance and work towards gender equality. But I'm pretty sure that this is just the beginning of the tasks we have ahead. And thank you again for your commitment and the results, which help us a lot. Thank you.
Thank you so much, Marisa, for your support and also the contributions you've made. Let me pass the floor to our dear colleagues from Italy, and let me introduce the panel. We have our colleague, and the team from Italy will present. The title of the panel is The Role of Health Professionals in Engaging Fathers in the First 1,000 Days, Why It Matters and Why We Have Learned. So focusing also on early childhood development. We have Anina Lubok. Anina is a gender specialist and the Parent Italy is part of the Parent Italy coordination team. Anina is a social scientist who, after an early career in applied social research in Italy, worked internationally for over 30 years for the later part of her career with the United Nations on gender equality and women's empowerment. As a retirement project in 2016, she created the Italian network on engaged fatherhood and shared care, Il Giardino dei Padri, and is a member of the coordination team of Parent Italy. And thank you, Anina, for your retirement project and joining us. We also have Andrea Santoro, chair of the association Cerchio degli Uomini and project coordinator for the Italian branch of the Parent Project. Andrea holds a MSc degree in political science and a master's in narrative writing. He's a writer, trainer, and researcher in gender studies, engaged fatherhood, men and masculinities, prevention of gender-based violence, bullying, and gender stereotypes. And we have the team has invited as a specialist, Dr. Giorgio Tamburlini. Dr. Giorgio Tamburlini is a pediatrician with a PhD in developmental pediatrics. He has been extensively consulting for UN agencies and international NGOs on maternal and child health policies and programs. He has contributed to the development and implementation of the Nurturing Care Framework and several ECD parenting programs in Italy and abroad, and is currently advisor to Italy's Ministry of Labor and Social Policies for the development of child welfare policies. Thank you so much for joining us, and the floor is yours, Italy. Thank you.
Tatiana, could you say a few words about Angela Giusti? Unfortunately, she wasn't able to join.
Yes,
but she's given her slides, and she's a major partner. So,
of course, sorry, my fault.
No problem.
Angela Giusti, she was also specially invited to come and to join us on this panel. She's having some internet connection problems. But Anina will show her slides and presentation. She's a PhD, a public health researcher at Italian National Institute of Health. Dr. Angela Giusti is a senior researcher at Italian Institute of Health in several public health domains, including maternal and child health in the first 1,000 days. Her many qualifications include midwifery and public and community health degrees, an MSc in adult education and lifelong learning, and a PhD in human and environmental health. She's a member of the parent training team, the technical advisory group, and has supported the project monitoring and evaluation process. Thank you so much, and I hope she's able to see us.
I hope so.
Thank you, Anina.
Okay, I'll share the screen. Here we are. Okay. So this presentation is about work package 2 of the parent project, which focused on building capacity to engage with men of professionals who interact with couples and with fathers from pregnancy through birth to age 4 of the child. This was what was in the project. In Italy, we use the first 1,000 days framework because it's a widely recognized framework within the scientific committee, because as we all know, 80% of the child's brain is formed in those critical first 1,000 days. Health professionals were the primary target in parent in 2 countries, Portugal and Italy, because the beauty of parent is that while maintaining the overall approach and focus on objectives, there were local choices about what was most strategic in that particular context. Austria and Lithuania worked with mixed professional groups. I've called them 0-4 professional groups. I think you know what that means. It's very broad. And of which in Austria, about 10% were midwives and medical doctors, and in Lithuania worked mainly with social workers. Now, why is it tremendously important to engage with health professionals? Now, we have by now an extensive and continuously growing body of evidence on the health, psychological, and developmental benefits of early partner involvement, benefits for the mother, the child, the father, and for the relationship, which of course is the connection with the meta goal of the project, which is the prevention of gender-based violence. Science tells us that the early caring engagement of the father predicts greater involvement of that father during the rest of the life of the child, through adolescence, right into adulthood. It has a huge impact. And science is also telling us that health professionals have a key role in promoting and facilitating fathers' involvement. And then, of course, we had the feedback from the professionals themselves, and this was a common experience in all the parent countries that worked with health professionals, where they have said, yes, engaging with fathers, involving fathers can be demanding because, of course, it's more complicated to work with two people rather than just one. But the outcomes are always better and at all key moments in the birth care path from pregnancy through early childhood. Another reason why it's important to engage health professionals comes from what fathers told us in the focus groups that were conducted in all 4 countries in the planning phase. The negative comments were the fact that professionals' services made them feel, oh, yeah, but this is not for us. This is not for fathers. As if the caring space was considered as a woman only, mother only space. They said they felt ignored. They felt that they were accessory. On the positive, we have fathers who reported that the health professionals acted in a way that communicated in a way that made them feel included, that they received information that was useful and above all specific to them as fathers, that they were given something useful to do, for example, at birth, except apart from just looking on, being put in a position of being of practical use and generally being recognized. Now, the interesting thing, which was confirmed by our colleagues in other countries, is that when the experience is positive, parents tend to say, oh, we were lucky, as if it were not an institutional organizational policy. And this happens even in countries, and here truly Portugal is in the forefront, countries that have very progressive policies about natural birth, promoting natural birth, involvement of fathers. There's still a lot of variation in the extent to which these policies are internalized by the services. Now, what did we do? Portugal trained approximately 100 professionals, mainly midwives and nurses, who attended 5 courses, 20 hours each, with some homework as well. Now, one course in person and the others online. Now, this happened to all of us. We all managed to do more or less a first edition of our courses in person, and then the pandemic struck and we all went online. In Italy, we trained approximately 130 health professionals, mainly midwives and nurses, in 3 interactive courses organized by modules, a general module for everybody, and then 3 modules, pregnancy, birth, and afterbirth, where we had different professionals attending according to the service in which they worked. This was a way, nevertheless, of reaching an equal number of professionals working at different moments in the birth cycle. The hours were from 28 online to offline to 16 online. But then we also reached about 600 health professionals, this time from all professionals and with a lot of medical doctors, in 2 3-hour webinars. One was a conference organized with the Italian Institute of Health on fathers' exclusion during COVID, which was a big problem, which we'll come back to. And the other with the Giorgio Tamburlini's Center for Child Health and Development conference on the father in the first 1,000 days, which was organized with the Brazelton Touchpoint Center network. Austria trained their first multi-professional in-person course. They trained about 1/3 of professionals. I just want to mention the interesting thing about this homework that was done, and specifically, for example, between modules, staff professionals were asked to fill in a diary documenting their interaction with fathers, and if fathers were not present, reflect on why. This was tremendously important because what we realized, it was enormously important to work on the attitudes of the professionals. So we did both in-person training and online training. So we can look back at this and see advantages and disadvantages. Now, obviously, in-person, service-focused, geographically focused training still works best in terms of networking, in terms of sharing, and above all, building relations between people that then can lead to better teamwork and coordination for the benefit of families, fathers and mothers. And definitely there are some methods that can really only be used in person. However, even online, thanks to apps that were either developed or were perfected during the pandemic, and to some very creative trainers. I wish Angela were here because she's really one of the most creative and imaginative that we have had, and our colleagues from IRIS Institute. This training can still be highly interactive, use participatory methods. Of course, it has to be synchronous and numbers have to be kept small. And of course, it costs far less, even about 50% less. And it can also include more people from different areas as well, which is interesting in terms of cross-fertilization, because within countries, the situation across regions can be very different. Here we have some examples of methods. We had a little video down on the bottom left. We created a little video role play on father support to breastfeeding. Not so good as an in-person role play, but it was pretty good, pretty effective. And then, of course, we used breakout sessions and electronic whiteboards. So I think that probably the future is going to, in future training, is going to be very likely a mix of both in-person and online. Now I am taking off my Anina hat and I become Angela, where we're going to talk about some data, some finding from Italy. The Institute, the Italian Institute of Health helped us with the monitoring and evaluation. But I have to say, talking to our colleagues, results are very similar across countries. So our training was focused on the knowledge with giving the scientific evidence of why engaging fathers matters, on attitudes, which we found was really the main driver of change for professionals who are already in service. And the majority of our participants were professionals already in service. And their role plays, case stories, exercises on personal stereotypes were part of this changing attitudes. Remember, most of the participants are women. We worked on practices, not so much new practices, but how to adapt existing practices to make them more father inclusive. And perceived competence, the extent to which health professionals feel they are competent in engaging men. We found that this barrier of this not feeling that they were very capable of communicating well with fathers was something that needed to be overcome. The assessment tools we used were a 53-item questionnaire, which we delivered before, immediately after, and 6 months after the course. The data concerned attitude, practices, perceived competence, and further training, and included items from the questionnaires used in Program P and the gender and the GEM scale. And then, of course, we had qualitative course assessments. This is some interesting data. The majority of the participants were female. And this is because the main profession represented were midwives and obstetric nurses, as they're called in Portugal, which of course is a highly feminized profession. We had relatively few medical doctors, about 10% in total, more pediatricians than obstetric physicians. This is an issue, but however, this would deserve a reflection, an analysis that we really don't have time for today, but definitely better ways need to be found to engage medical doctors on this topic. In terms of place of work, it's interesting that we actually achieved a good balance between professionals working in community services and those working in hospital. Interestingly, I'm missing, I can't see the figure here, but you can, I think. Oh, here we are, got it. Yeah. So we asked if they had had any previous training on any of the main topics covered by the course. 56%, therefore nearly 60%, said they had never had training in any of those domains. 27% had had training on intimate partner violence, which is actually a good sign that this issue is beginning to be mainstreamed within services, but very little on all other topics. So definitely the training was important and a first for many. Okay, I'm not going to go into detail on these evaluation results, except to say that in the domains of knowledge, attitudes, professional practice, and perceived competence, there was a significant and measurable impact in all of these domains. So the conclusion of this is, yeah, we need more of the same. We need more projects like Parent, although we also need more, and Andrea will eventually be talking about, and Giorgio will be talking about this. Now, we just want to mention a few lessons learned on 2 or 3 key topics, and then we wrap up with some overall conclusions. Now, what happened during COVID? This was a common experience across countries. When the pandemic hit, almost everywhere, to a greater or lesser extent, fathers were excluded from the birth cycle, from prenatal, antenatal checks, and specifically at birth, from postnatal checkups. And many, many mothers were accompanied at birth, so they were not able, as WHO recommends, to have at their side the companion of their choice. At some point, we began to understand better how the infection worked. So there was scientific evidence emerged. There was policy guidance from WHO in Italy, from the National Institute of Health and the Ministry of Health. And then there was social activism also pressing to open up, to allow men in again. But actually, not all services and birth units made efforts to restoring inclusion. And actually, some old practices of exclusion, medicalization, prohibition. We even heard one midwife say, you know, the one good thing about this pandemic is that we got the fathers out of our way, which is rather tragic. So the 2 questions are, how long will it take us, quite simply, to reestablish the pre-COVID situation in terms of inclusion and togetherness of couples at the moment of birth, and then move on to generalize these practices? Now I'm turning over to Andrea, who will, in the end, he will wrap up with some general conclusions, but first give some feedback on 2 important topics. One is how we dealt with gender-based violence, and the other, the issue of migrant fathers. Over to you, Andrea.
Thank you very much, Annina, and thank you to you all to being here. After consider that our main goal was engaging men as fathers and caregivers, we must not forget that the gender-based violence prevention has always been the meta goal of this project. So what did we learn working with healthcare professionals on the topic of gender-based violence prevention? First of all, this is a topic which must be handled with care. These to avoid reinforcing stereotypes on men as potential perpetrators. Then it was important focusing on couple relations because what happens within the couple during the pregnancy, birth, and after the birth is relevant for the future of that couple and for that family. So the ability for the couple to have a relation based on mutual respect. And then we learned that the transformative effect for men of involvement at birth and of early father-child bonding. While inquiring screening methods for gender-based violence prevention in the first 1,000 days, we also saw that in engaging men and fathers as caregivers has a really benefic effects for the future of the behavior of those men. So, and then focusing on caring fatherhood benefits not only men, but all the family. And this not losing the focus on the maternal and child care, which is the main attention in the first 1,000 days. Next slide, please. Then we worked with my grandfather in many different situations, and we learned that it is important to mainstreaming a general approach of inclusion for migrant fathers in the first 1,000 days. This in order to avoid stereotyping and prejudice, because migrant fathers are fathers as well, willing to be good fathers, just like Italian or European fathers. So, the one interesting topic is the language barriers for certain women and certain families who did not yet learn the language. We saw that men can be an opportunity and in some cases a risk for women's autonomy when as partners help women, they help women with the translations. And so they can help their partner, but they can be in some cases a risk when not doing that properly. Next slide.
Oops, sorry.
Okay, so in the end, we saw that there is an evident and growing demand from institution and professional, as Annina mentioned before, for training like that, for more of the same. And we really saw that the parents' comprehensive, multidimensional approach to engage fatherhood, for which we also have to thank Men Care and Promundo, has been a factor of success, and it is a relevant approach for mother and child health, a positive and balanced child development, for fathers' well-being, for gender equality and shared care, and for prevention of gender-based violence. And in fact, this approach has many similarities with the multidimensional approach that is spreading and having success working with perpetrators, with many agencies working together, coming together, and sharing different visions. Next slide, please. So each country, each team had different entry points, working with health care professionals, and the parent approach let us establish and sustain, creates and sustain synergies and partnership between different institutions, different professions and activist groups. And this was a great goal of the project. Here in the picture, we can see me at the 16th meeting of the network together for breastfeeding, during which we established a good partnership with UNICEF. And next slide to the conclusions.
Oh, sorry. Yep.
Okay, so there is a good demand for training like this, but in doing so, we should consider the context, because the context is relevant for implementing the trainings and our activity. For example, the culture, the stereotypes of each country on parenting and child education and care, the policies, for example, the legislation on paternity leave, if there are in healthcare services active promotion of engaged fatherhood, like Portugal's impact, and if there is a specific approach to early child development and care. Then the healthcare organization and culture, if there is which degree of medicalization of birth, if there is a weak or strong recognition of women's autonomy at giving birth, and if there is the level of pre-service education of health professionals. We saw the situation with the trainings of engaging fatherhood. And then the main topic, the general topic of gender equality, both in care and in the employment, in practice and in national policy. And last but not least, the national policy and practice on gender-based violence prevention, where we were able to work with healthcare professionals. It has been because in the healthcare system was considered that the topic of gender-based violence prevention was considered relevant, and that we cannot take that as a given. Next slide. So, working with healthcare professional has proved that parent approach is successfully, and we need more of that. But what next now? It is interesting discussing now with Dr. Giorgio Tamburlini, chair of CSB, Centro per la Salute del Bambino, how to extend and sustain action and the impact of the parent project, what to do next. Thank you. The floor to you, Giorgio.
Good afternoon to everybody, and thank you for involving me in this discussion, which is meant to be productive.
There's a lot of noise. A lot of noise from there.
Yes, just a minute. Is it better now? I'm a public place, unfortunately, so I have to ask the permission of others to become silent, which in Italy is not always so easy to obtain. Anyway, just one thought that I just made. You are certainly familiar with the European Next Generation Fund. And you remember these two transitions where the European people should be involved in the next years is the digital transition and the ecological transition. This is very technical, probably very important, but the more I get involved in these matters and the more I become convinced that this transition that we are trying to promote, which is towards co-parenting, towards a different, share of family life between men and women, is at least as important as the two we have just mentioned. So just to follow on Andrea's presentation about what can we do about improving and sustaining what we have done already, what you have done essentially. Well, first I think we have to work systematically with professional societies. And when I mean professional societies, I mean European-wide societies. For example, we have the European Primary Care Pediatric Society, and we have the chance of have the vice president in Italy, Laura Reali. Maybe you know her, is a pediatrician from Rome. We have WONCA, the Organization of Family Doctors. And so just not to continue the list, I think we have to engage these societies in work towards producing guidelines for their associates. So that's something that we can do, and I think we can achieve in a relatively short time. Of course, we have to maneuver a little bit and lobby to introduce in their congresses and activities this matter. Another thing which I'm currently engaged with Angela Giusti from the National Institute of Health, that you just mentioned her, is a module which is both theory and practice, including supervision, about nurturing care. And of course, when we talk about nurturing care, we talk about fathers caregiving as well, and co-parenting. So I think we will engage some of you in developing this module, which is supposed to be the module to be included in both pre-service curricula and also in-service continuous development. And that's something that we believe a lot on, because sometimes it's good to work from the grassroots level, but sometimes you need strong institutional support to change the way that professionals are trained. And midwives, by the way, are supposed to be part of this work. So, I mean, the two main health professionals engaged with mothers, fathers, and the couples in general will be involved in this. But besides this, I think we have to start asking our midwives and our doctors, and pediatricians in particular, to directly ask for the presence of fathers in the well-child visits, for example. The well-child visits are visits that are planned. They're not for acute complaints. They are more or less 6, 7, 8, or 10 in the first 3 years. You are supposed to promote health, but the most recent guidelines include and should include promotion of development. When we talk about this, we have to involve fathers. So the recommendation that should be made to both midwives in the prenatal courses and to family pediatricians in their well-child visits, maybe with a sort of format we could even distribute to them, is how to directly invite fathers in these events, because this is just natural, it should be. So it's an introduction, And exactly the same thing as you said before should be done with educators in daycare centers. I just want to add to other aspects. One is that we have just started to work with corporate business. I mean big businesses in the finance, in the commercial, in the service business, etc., working with their employees who are also mothers and fathers, or new mothers and new fathers. Because this big business, as you know, they offer to their employees what they call welfare benefits or welfare packages. But we are trying to convince them that in these welfare packages that should include some information, if not real training for these new parents. And of course, we have already mentioned that we would like to discuss the role of fathers within this. And this is a promising thing, because when we're talking about changing norms, of course you have to act on legislation, but you have to act on the wider public. Finally, we have recently established a good collaboration with parliamentary groups. In Italy, we have a group that takes care of infancy and childhood. It is a group that puts together different parties, which is good. A motion was actually approved by all parties 2 months ago about investing in infancy. So I think the field is ready for an intervention also at political level about, father's leave and all these things that have been mentioned by Tatiana at the beginning of this meeting. Well, I will stop here. I think we have a lot of work ahead of us, and we have to assume that system change is our ultimate goal. We know what to do. We know what is necessary. Now the time is come to go to system action and to change really the world around us. Thank you for involving me again. It's been a pleasure. And congratulations for the work. That was really inspiring also for us. And we started to collaborate maybe a year ago, not much more. But we have done a lot of things together, and I think will be for the better for the future. Ciao.
Thank you so much, Dr. Giorgio Tombolini and the Italian team. It was a great presentation. So now from Italy, we're moving to Austria, focusing on engaged fatherhood through educational groups. How can we promote it? Experiences and recommendations from the Parent Fathers Laboratories. And representing Austria, we have our colleague Ellie Scambor, the Parent Austrian Coordinator. Ellie, really well-known researcher on the field of masculinities, caregiving, and fatherhood, is a sociologist and the managing director of the Institute for Masculinity Research and Gender Studies at the Association for Men and Gender Issues in Graz. She coordinated the first systematic European 31-country study, the study on the role of men in gender equality, that was inspiring and inspired a lot of our work. And it was central in the development of the concept of caring masculinities in Europe. She carries out field research on workplace conditions for caring masculinities, early care and the role of men, as well as research on gender-based violence and violence resilience from an intersectional perspective. She's a lecturer at universities in Graz and a board member of the umbrella organization of men's work in Austria. Also joining us and invited as a specialist, we have Dr. Ines Pamparl, from the city of Graz, the managing director at the Office for Youth and Family Medical Service. Dr. Ines Pamparl, she's a physician and a nutritionist. She is the head of Health Service, Youth and Family Office in the city of Graz. And the health service is integrated into the city's administrative body, and she's one of the cooperative partners of our project Parent. She and other youth and family office members attended an online multiplier training program to encourage active paternity. Thank you for joining us. We also have Mac Hubert Steger from papainfo.at, Vienna. Hubert Steger is a clinical and health psychologist, a longtime employee of the Men's Counseling Service Vienna in the field of general family counseling, father counseling, and victim protection. He wrote his final thesis in his studies on the role of the company's framework conditions for taking paternity leave, and is the main author of the guidebook Vaterarbeit, Zeit für dein Kind, Father's Work Time for Your Child. How was the pronunciation? Yeah, he has repeatedly initiated fathers' projects, for example, workshops to prepare expectant fathers for childbirth, and together with other committed colleagues founded the association Papa Info. This I cannot pronounce, Association for the Promotion of Equality-Oriented Father Work, and is a member of the DMO, Umbrella Association for Boys, Men, and Father Work. Thank you for joining us. I'll give the floor to Austria. Thank you very much.
Thank you very much, Tatiana. Yeah, hello from Austria. It's a bit like the Eurovision Song Contest when we talk about it. So I would like to say, before we start our presentation, I would like to say thank you to all people who made this project happen, and especially also the Fathers group happen. And here I would like to take the opportunity and to name all the people from the Austrian team who cannot take part today. First of all, Anna Kirchengast, Wolfgang Obendrauf, Thomas Seiko, Veronika Supan, who is part today. Hi, Veronika, and Moritz Daritzwacker. And I would like to say thank you to the co-financing partners in Austria. So not Solidarity EU, but also the co-financing partners, City of Graz and Province of Styria has made this project happen for Austria and Styria in general. So I would like to give the floor to Dr. Ines Pampal. It's great that you're here today. Before I give a short introduction in the education program.
Yes, hello to all of you. And I give 12 points to everyone. As far as you said, we are the Eurovision Song Contest, so 12 points everyone as far, and in future, of course. Yes, thank you for the possibility to share this conference. Focusing on men's caregiving is really an important part concerning early prevention, and early prevention is the main aim of the Youth and Family Office, special to the health care service, what is part of the Youth and Family Office. So we were really lucky to cooperate with the Parents program. And, you know, not in Austria, but everywhere, we know it's difficult to reach parents, and we always wonder how can we reach them. So this was an interesting program where we learned other ways to reach men. And in spite of Corona, we were able to reach parents, so parents to be, as well as parents with young children. And in the city of Graz, the first possibility to inform parents is the welcome folder, and the welcome folder is handed out to new parents. And the next part where we could inform parents about the fathers' laboratories are the parent counseling centers. So in the city of Graz, we have 15 parent counseling centers where young families can come, and there's always medical information, but some other informations too. So if young families have questions about their children, they can come, and it's for free. And the third possibility to reach fathers is the program Kleinheitsfein Family Pass. So this, for example, includes birth preparation classes where we have different topics where we talk about birth, about how to care, how to nourish the children. And what we saw that in the usual programs we had so far, so this is from person to person, we could reach about one third of the audience were fathers, yeah, or fathers to be. And with the switch to online, we reached at least 50%. So what we can see that with the that COVID not only was bad experience, this could be in future times the way to reach the fathers online, because they sit at home with their family, they can chill a little bit, and they listen and to what we say, or what or they watch, yeah, our presentation. So what we are going to do in future is to offer fathers only units in our pregnancy and birth preparation programs, because this is the part where we can see that we can reach the fathers very early, because the part where the woman is pregnant, even the fathers to be are very aware of things. They listen, they want to help, they want to know how to do it, but sometimes perhaps they only want to ask things not together with their female part, yeah. So this is what we learned, that we try to reach the fathers this way. Yeah, so I thank you very much for the possibility again to be part of Parent, and we will spread the informations, I hope. Thank you.
Yeah, thank you very much, Mrs. Pampel. It was a great support, and we were able to reach many fathers here in Austria, also because you provide excellent frame conditions. Before we now go into the Fathers Group program and to some topics that are really relevant, so Hubert will talk about that, I will do a short presentation on what has happened in the Parent project. So I will share my screen and hope that it works. Okay, you can see the screen? Yeah, perfect. So this is what I'm going to talk about: promoting engaged fatherhood through educational groups, our experiences in the fathers programs and laboratories. And I would like to say, as I said, we had the co-financers, the province of Styria and the city of Graz, but we also had cooperation partners, the umbrella organization of Minds Work in Austria and Papa Info AT. So talking about the frame is important in the beginning. So for some years now, masculinity research, as you already mentioned, has been discussing the concept of caring masculinity. So what does it mean? It is a form of masculinity, or a concept of masculinity, which includes values like attention, interdependency, but also co-responsibility. The approach relates to, on the one side, practical caring activities, caring for kids, caring for elderly, caring for colleagues, caring for yourself. Self-care is an important topic if you talk about men's health. But on the other side, it also contributes, or it also reflects attitudes. So caring concepts of masculinity contribute first to gender equality, and in doing so, do something like a rejection of violence and also a critical eye on male dominance. So one life area where caring masculinities can be realized is engaged fatherhood. Engaged fatherhood means the participation of fathers in care work, childcare, but also housework, and not solely around birth, because kids get older, hopefully. So it's a lifelong duty. And it opens the opportunity to break out of traditional role models that only knew man as breadwinner and as provider. So what are the benefits? We have in different studies, we see multiple benefits of involved fatherhood that can be traced, including better relationship quality with partners, including relationship qualities with children increases, and including lower risks of violence and domestic violence. This is one of the important parts also of this project. So active fatherhood also contributes to child's health, as Moore et al. Pointed it out, and the systematic review of Sarkady et al. Found out that quotation father engagement positively impacted social, behavioral, psychological, and cognitive outcomes in children. And I would like to make one more point. Someone also referred to the quality of life study. So surveys in Poland and Norway furthermore show a lower chance of violence in gender equal homes. So in both countries, and this is also the basic ground of the quality of life studies, men and women give a very similar report regarding violence and decision-making in childhood. So the parent who made the decision at home in the family, the parent who had the final say, was also mostly the one using violence, using physical punishment against children. And the highest rates of physical punishment of children were seen in families in which the father only decide pattern was evident. And I think this is a result we should really pay attention to that. This is the basic ground of our project, Parent as well. The State of the World's Fathers 2019 report identified 3 major barriers for father to be involved in the early weeks and months for caring for children. The first thing is the lack of adequate paid paternal leave. So Linda already mentioned that. The second is restrictive gender norms. And the third one is the lack of economic security and governmental support for parents and caregivers. And I would like one more time to mention the dominant model of the father as the sole breadwinner was regarded also as a structural challenge for realizing active fatherhood. So the parents' needs assessment found out that there are already some measures supporting engaged fatherhood. For example, providing space for father-child interactions, activities that promote exchange between fathers networks, skills and information offers like, for example, breastfeeding groups for fathers, as pointed out in Italy. We also had it in Austria. But it also showed the parent study that fathers did not equally participate in the offered measures, either due to time constraints or because of traditional distribution of responsibilities in their families. So fathers were also not systematically approached and often felt uncomfortable if they were the only man attending. And there were special barriers for family who in Austria, for example, lacked German language skills. So one of the first education programs in Austria was really a program where men with international family histories took part. So parent educational trainings with fathers can be regarded as one key to achieve greater equality in care work and increased involvement of fathers. So skills, competences, confidence should be strengthened. This was one of the main goals in order to support shared decision-making and not sole decision-making, and in order to support a violent-free communication. Here again, one quotation from the further study: evidence-based, further inclusive parent training exists and has shown to achieve reductions in violence against children, reduced violence by men against women, and increased participation by men in caregiving. And I think this is a crucial point here also in the parent project. And now go to the point, what did we carry out and how did we do it? So now to the different countries and the different formats of father's education in the parent project. Italy organized workshops under the project name Circle of Dads in Reggio Emilia, Montecchio. The cycle was run between February and June 2020 with 8 meetings on evenings, and as a final meeting, a lunch with barbecue in the park. So this cycle of meetings with fathers and fathers to be involved, a total of 22 fathers in Italy. In Lithuania, not only fathers, but also mothers could attend the training session. They were invited to join in. So in the first session, 19 fathers and mothers attended the session. In the second training, they reached 24 fathers and mothers because all participants in Lithuania were recruited through cooperating kindergartens. All participants already had children of kindergarten age. In Portugal, 25 fathers participated in 3 parent groups. Initially, the formation of educational groups was planned to take place in person, face-to-face. The first session was even held face-to-face, whereas the other 2 sessions were online due to the current events in relation to the COVID-19 pandemic. In Austria, Austria organized 25 workshops with fathers, mainly men, with 55 participants on the topic of active fatherhood. For this purpose, the workshop series Vaterwerkstatt, Father Laboratories, was founded, which aimed to support and encourage fathers with children between the age of 0 and 6, but also expectant fathers in their role as active fathers. The Austrian educational groups with fathers took place between November 19 and May 2021, and the last one will even be carried out in the beginning of July. So next week we will have maybe our last parent education fathers group. And we did it with in close cooperation with the co-founding partners, the city of Graz and the province of Styria, with childcare care centers, birth preparation departments of the state hospital in Graz, and public parent counseling centers in different districts. So I will not really go in detail into the topics because Hubert will take over. Just very short, a focus was on all the countries on transformation of social norms and gender norms. So I think in Portugal it was called Fatherhood in the past, present, and the future. The laboratories focus on children's rights and women's rights and on pregnancies, expectations, joy, and fear. On parenting from a development, psychological, and a health perspective, on paternity leave and public services, but also, as I said, on network building and violence-free relationship challenging in living with children, how to go on with challenging situations. This was the main topic. Yeah, I come to the conclusion. It is relatively easy to reach motivated fathers. This is an experience we made in Austria. Other fathers are difficult to reach. So therefore, work with fathers is, as we called it, a combination work. In order to reach fathers, professionals need to be sensitized to the issues. The training of the professionals was regarded to be one of the crucial factors for the quality of such education program. It's needed that professionals reflect about their own attitudes to gender, violence, and also from an intersectional perspective. We talked about men with international family history. This is an important point. A second point is important. Pregnancy and birth preparation are the window of opportunity where fathers can be reached particularly well. So we can really reach fathers around birth. At this stage, fathers should be directly addressed, as Mrs. Pampel pointed it out, with and in childbirth preparation services with special units for fathers. So fathers only units are necessary. This is a second conclusion. Another conclusion is that many men are unsure about their new role as fathers. Partnership, sexuality, dealing with the babies, being a good father, these are central topics. So support services for fathers are only marginally available and largely little known. It is important to create the offers and communicate the offers, and also it is important to focus on topics that are really relevant for men becoming fathers. And last but not least, the legal framework conditions help if additional care is taken to ensure that they are implemented in companies. Audits and support actions are needed to prepare or to support a better workplace conditions for men. So thank you very much. I end here with the conclusion, and I hand over to Hubert Steger, who will give us a short inside view into educational groups with fathers.
Okay, thank you a lot. Thank you, Ellie. Yes, I would like to give you some insight.
But we don't hear you.
You don't hear me? Is it better now? Can you hear me now? Okay.
I didn't hear you. It was my fault. Sorry.
Okay, fine. Okay, then it's fine. Okay, I want to give you some insight in the experience. I work with educational groups with fathers. I work with them since 2006. It was the first when I, as a young psychologist, was high motivated to work with fathers because of my special interest, because also of the work I wrote during my university study. And therefore I tried to reach some childbirth preparation services and to have the possibility to reach fathers there and to be with these fathers and to have the permission to make some special group with these fathers. And since this time in 2006, I'm still working in this field, but I'm not alone. Now I have other colleagues doing also this work, and it's a really nice work to do, and it's really interesting. It's really motivating to go on this work, and it's also we at the beginning I was alone, and then I tried to reach other colleagues doing the same work, because I'm also a father, and this is a really additional work. It's not the whole work I do during the week. That's an additional work, sometimes not well paid. But now we reached also the fact that now it's paid well. It's paid, yeah, that's good. And I needed to have other colleagues to make this work, because at the weekends, this work is at the weekends. It's especially at the weekends. We reached every weekend 40 men in these groups during the last years. And yes, we have been twice there on a child birth preparation service in a hospital, in a private hospital. We reached there really motivated fathers, and also with these motivated fathers it is a challenge to go through this education group, which has. We have 2 hours of time to be with the fathers, with this man going on to be a father. And there are some themes, some topics, they are special interest for them. For example, how they can support the wife during the pregnancy, during the childbirth, and also after that. And especially for the time after the birth, we we focused on this time, because if we made the experience, if the men are sure about, or they feel more comfortable what can be after the birth, how is it going on after the birth, how can I manage with my workplace, how can I be a father who maybe works part-time after that. This is a really for a great interest for them, for these men, and also how they can how they can manage the competence, how can they go on to be really competent in going in being with their child, and the wife seen as a gatekeeper for giving them the possibility to be there, to be on their side, to be alone with the child, with the baby, to do all this work, to do all things which is necessary to do, and also to have time for themselves, time for the couple, with maybe sometimes also without the baby, without the child. And in this short period, we have, if we are in this short period we are there, we don't have much time, but the reflecting process is the first point we have on this time. And for the man, it's really important that we are there as a man, not other personnel from the hospital. Especially important is that we are there for as a man, and men counseling other men education that gives education for other men. That's really important for the participants. And after that, I work in a counseling center. Others from our professionals are also working in counseling centers, and we see that the men, if they have problems, if they see some problems also with violence in the family, or if they see that they are at a high level of stress, for example, then they think about, okay, I have been there, I could take help, I could go somewhere, I can have some help. And it's really possible then to come to us, or to have other possibilities, like a therapy group, for example. We also have in our counseling center, or also a specialized group for men who has been violent against their children. It's also possible to come here and to have this support then. And also these possibilities we have here, we have a full group during the whole year. We have full groups during the whole year, and it's really needed and really important to going on with this work. Yeah.
Thank you, Hubert. I'm just looking at the time, because we still, I think, we said we have 10 more minutes or to go, and the presentation from the Lithuanian partner. So thank you very much, Hubert, that you provided an insight into the work with men, so around birth, but also afterwards, and that this is a step towards men's counseling. This is really an important issue also to think about this into this direction. So thank you very much. I hand over to Tatiana.
Thank you very much, Ellie and Austria, and thank you for the specialists who joined us, and thank you for your support and work. And now, last but not least, we go to Lithuania, and the specialists invited, and representing the team from Lithuania, we have Dr. Vilana Pilinkaitsotirovic. Sorry for the accent. The presentation from Lithuania will focus on active fatherhood as a strategy for prevention of domestic violence and the role of social workers. Vilana, she's the researcher at the Lithuanian Social Research Center and gender expert in the Center for Equality Advancement. She has more than 15 years of experience in doing research, gender and equality, gender-based violence and gender mainstreaming policies. And in the Parent Project, she was the coordinator of the Lithuanian team. She was also a trainer, a facilitator of meetings with stakeholders and partners of the project. We also have Dr. Margarita Janskauskaite from the Center for Equality Advancement. Dr. Margarita has been working as the project manager and gender trainer at the Center for Equality Advancement for more than 15 years. She applies diverse, interactive, and innovative training methods to transform gender stereotypes and biases among different professionals, civil servants, employers, and NGOs. In the Parent Project, Dr. Margarita completed a leading role in training activities for social work and educational groups for fathers. We also have Vilma Gabrieliut, Head of Discrimination Prevention and Communication Group at the Office of the Equal Opportunities Ombudsperson. Vilma is the head of the Equal Opportunities Mainstream Group at the Office of Equal Opportunities Ombudsperson in Lithuania. She has more than 10 years of experience in the field of gender equality and sexuality education, high expertise in developing methodologies and conducting trainings. And in the last 2 years, she has contributed to the project on building up gender-based violence prevention mechanisms in schools, challenging prevailing gender norms, and encouraging schools' community for change projects. For example, workshops to prepare expectant fathers for childbirth and, sorry, it was a wrong page. Schools community for change. And I think these are all the short bias presentations. Thank you for joining us. Go ahead, Lithuania.
Thank you very much, Tatiana. And I will share the screen. So do you see? Do you see my presentation? Okay. Well, we are the last and the time is running, but I hope you will also stay with us for this 10-15 minutes. So our work was on active fatherhood as a strategy for prevention of domestic violence and the role of social workers. Basically, we were very much inspired and interested in the project that proposed the gender transformative approach to deal with gender-based violence and to improve prevention of domestic violence. Well, domestic violence is really a hot topic in Lithuania. We have a lot of calls for domestic violence, and 16% of all crimes in Lithuania is on domestic violence, and COVID situation also worsened this field because much more femicide and heavy body injuries occurred during this period. So prevention is still in the development, and we thought that this approach to work with fathers, with men, to change stereotypes, it would be a new innovative step in developing prevention and policies on prevention of domestic violence. So we took also inspired and by Casey and its team to how to approach and how to conceptualize transformative approach to engaging men in gender-based violence prevention. And here we were inspired because it proposed like 3 interconnected domains, which makes like reciprocal cycle if we want to really achieve change and ongoing social change. So in this conceptual model, the initial outreach of men and boys is it should should be ensured, and also attitudes and behaviors of men should be changed. And in order this change would be sustainable, we also have to think about broader societal change in order to keep this sustainable in gender equality. And what at the beginning caught our attention very much, that we spent a lot of time in previous project on working on stereotypes and attitudes of women and men, and change this understanding and concepts of gender social roles, but we also thought that it is not enough that we would reach only men and trying to change these attitudes, because this is also very important, but to spread this necessity of changing attitudes, and especially work with those specialists who has access every day to women and men, especially in the context of gender-based violence, and that they can work with men, and because they have outreach, and they can really work every day with men and step by step change the attitudes, stereotypical attitudes about masculinities, and also ensure this ongoing social change. So why we chose to work with social work professionals different than our partners, because through our focus group and initial need assessment activities, we realized that the healthcare professionals had different approaches, and they were engaged with a different program. And social work professionals, they were very motivated to experiment and also more be engaged in this preventive work. And the motivation is very high, but as they also told us that they need more knowledge and tools how to work with men, because they can reach them, but how to work and really engage them in parenthood, and also this different understanding of their masculinity is still needed skills and knowledge. We thought that this is a good platform for us to work, because they can intervene through the social services. They can challenge this hegemonic masculinity, but also what we noticed that we also have to work with the attitudes of the social work professionals, because they still, they have these stereotypes and, understanding of social gender roles. And in order that they would be those changing agents in the gender-based prevention interaction, they have also worked with their own attitudes and stereotypes. So for this purpose, we introduced an innovative methodological approach, which I will ask my colleague Margarita to present it.
Yeah, so as Ilana already told, changing attitudes was main target for our workshops, and we decided to apply a conscious competence learning model, meaning that we can measure how competent, what degree of competence our participants have, and what degree of consciousness. So basically, unconscious incompetence means that people do not understand, that they do not know, in our case, about gender equality, stereotypes, gender-based violence, caring masculinity, and etc. So if our or your participants are in this level of consciousness, it probably you will face very strong confrontation from their side. It was not our case, because the majority of our participants, they were on second level of consciousness, and in this model it is named like conscious incompetence. So basically people already understand that they do not know. So when participants are in this level of consciousness, they are actually very open for learning, and through learning they can move to third stage of conscious, when people become consciously competent. And Vilana lately will show you some numbers, and you will see that actually results were like quite good. I talk about this conscious competence, but actually our goal, maybe not just in project, but in general, to reach the stage when people become consciously incompetent, meaning that all they practice is based on certain attitudes, certain norms like gender equality, sensitivity for gender-based violence, caring masculinity, involvement of fathers. But this unconscious competence could be reached only through experiencing, so basically applying knowledge in practice. Yeah, so I would say that we were very successful from moving from consciously incompetent to consciously competent participants. And Vilana now will prove my words by numbers.
Thank you, Margarita. Yeah, it was this like methodological approach, and we had trainings in parent project just before the lockdown. Well, we quite early started with the recruitment and training, so we like organized 6 trainings for different groups for 24 hours. That means that we had 8 hours face-to-face meeting, then we had 8 hours homework, and then meeting again for 8 hours. So the trainings were December 2019 and March 2020. So just before the lockdown. So in total, we reached 125 individuals, and that was like the trainings were organized in different parts of Lithuania. So we were traveling around, and as the trainings were for social workers, though. Well, the social work is mainly a profession for women, and we had only 3 men in among those 125 participants. The median age of the participants was around 40 years. Up to 90% of participants held a university degree, and almost half have more than 5 years of professional social work experience. And the topics that we included, well, there were not so many of them like on theory, but like theory integrated in the practice. And we went through the childhood memories exercises, then norms of masculinity and paternity, domestic violence, control and power wheel, equality wheel as prevention of domestic violence, gender stereotypes in everyday life, and cake of responsibilities, where we were talking about balancing this work and care responsibilities in family. And basically all these topics we integrated for social work professionals, that like also with the aim to change their own attitudes, but that was also for them as a material how they can work with men when well, during their everyday work routines, because they got also knowledge and also methods how they can include men, how they can start discussions with men, how they should listen to men, and so forth. So that was like a double double purpose of this training and these topics that were not only for the social workers but also as a like methods and knowledge for them to work with men. And as a result, just because we did also questionnaires before and after the training, and I will not go through all those questions because there were many of them, just several, just to show how what was the impact of the training, how social workers basically changed certain attitudes about their own role and what they can do. And for example, they told that to the question, I know how to encourage fathers to more actively engage in preparation of childbirth, we can see that after the second round of the training, almost half of the social work professionals thought that they can do this. Before that, in the first round, it was only 13% that they completely agree that they know how to encourage fathers to be more engaged. To the question, I urge women to encourage their male partners to participate in pregnancy consultations. So, well, only half of the participants were ready to do it in the first round of the trainings, but like before the trainings, and then after that it increased almost 30 percentage points, like almost 80%, more than 80% told that they urge women, they will do this. And also about fathers, that I personally encourage fathers to participate in the pregnancy consultations. So basically, before that it was around 38%, and after that it increased up to 2/3 of the participants told that they would do this. They know how to encourage fathers to participate in the pregnancy consultations. And the final, also about the social role, that to the statement that I urge co-workers to encourage fathers, men to participate in the pregnancy for consultations. So again, the increase is very high, because before that almost 40% told that they do urge their co-workers, but after the second round of our trainings, so up to 8% told that they will do this, or they do already encourage co-workers. So we can see this change very significant, and it really worked. We think, of course, we know the limitations, because, well, the trainings were voluntarily, that, the participants came already motivated, and this motivation was felt during the whole process of the training. And of course that they were open for the getting knowledge. But on the other hand, as already Margarita mentioned, that this methodology proved to work when you try to bring those knowledge and change of attitudes through the experiences, through practices, and then building knowledge through their own engagement. So as a conclusion, again, we have to think about promoting the ongoing change. And while we do understand that we only trained 125 participants, but we, at the same time, we were doing promotional campaigns, and one of the campaigns that we are planning to show for you today, but we will show after the comment of our colleague Vilma to the to presentation and also to the project.
Okay, thank you, Vilana. And I thank you very much for the invitation. And it was really interesting to hear to all the presentations. And I'm really impressed and inspired by your work. And I want to emphasize the importance of your commitment to change the norms, actually. And me, myself, as a gender equality and sexuality educator, I see how important it is to challenge the perception of gender stereotypes and to encourage critical thinking and to allow people to reflect the negative impact of prevailing gender norms. However, sometimes I suppose it may feel to be a never-ending effort, as those gender-related expectations are very much rooted in our culture as well as in environment. And for example, a few years ago, Office of Equal Opportunities Ombudsperson that I work at has carried out an analysis of textbooks and other educational materials. And the study revealed that gender stereotypes could be found in different subjects, even in music, geography, or math textbooks, and so on. It's very interesting that women and men are portrayed differently. They also engaged in different activities and also use different tools for that. Also, activities that men engage are represented as more important jobs as what women do. And of course, taking care of children, for example, is not one of them. But the saddest part from this study, from the results of the study, is related to masculinity norms. And the aggressive behavior between boys is normalized, for example, with comments by like boys will be boys. But also there are no examples where men are depicted as those who take care of others. Well, unless there's a scene, for example, of father playing football with his son or going fishing with his son and so on. In other words, our educational system doesn't invest in boys' emotional intelligence, and attributes such as being sensitive, empathetic, responsive, emotional available are not shown as a value or something that each boy could relate or identify with as a part of being a man. Well, and it's not only textbooks, it's also the environment that is designed more for mothers, but not for fathers. If we would also remember the advertisements of toys, it's probably hard to remember a boy pictured playing with a baby doll. But it's also, especially in Lithuania, we have plenty of public spaces where there is mother's and child's room, not the room for taking care of the child. And also we see women having babies and taking care of them in children's books and so on. So it's also important to have in mind the inclusive environment. So also the fathers that are involved in parental leave, in taking care of children, wouldn't feel so lonely as we discussed before. So I think it's really, I would fully agree that we need more projects like Parent, because we really need more good examples of fathers being emotional intelligence, and it also affects all of us, our mental health, as well as quality of our life, and also helps to prevent gender-based violence as well as violence against children. So even if it's a really long way to go, but with all those initiatives you already did and continue to do, I believe we will bring the change. So thank you all for your good and important work.
Thank you so much. It's really exciting to see all the results systematized and all the reflections shared here today and lessons learned. Thank you for those who are still with us. We are going way beyond time, but we wanted to end this session by sharing with you, as Vilena mentioned, some pieces of our national and European campaigns, because as you know, we not only do research, we also do direct interventions, but we want our work to have community impact. And so we know that campaigns being photo campaigns, films, short films, and animations, they can last long in this digital and virtual lives that we have now. And so I wanted to ask Tiago to share some pieces of campaigns developed at the national level and also as a consortium. In these first pieces, we can see some pictures from the Portuguese campaign that we now translated into English, and that we hope that you and other partners can use in your own contexts and work. Go ahead, Tia, just share some more pictures that we have. Precisely 12 years ago today, we launched the Men Care Brazilian campaign. And this is an interesting story. This father and daughter, they were part of the Brazilian campaign launched 12 years ago. And now they live in Portugal, in Coimbra. They came here to work and study, and they accepted to be part of our national campaign as immigrants in our own country. So this is a very interesting story. And today, Facebook and social networks reminded us that it was precisely 12 years ago that it was launched using these same models. Go ahead, Tiago. And now we want to share a video produced by Austria, correct? And I wanted to ask Ellie to give us a brief explanation of what we're going to see. Thank you.
Yeah. Very briefly, I want to say when we were affected by the first lockdown, it is a bit more than a year ago, we were in the middle of doing all the education programs with fathers, and we were stopped immediately. So we thought, how can we go on with this situation? And in this situation, we decided to launch a call. We asked virtually on the social, on the internet, we launched a call asking fathers how they go on with that burden. So this was the first time in the life of many of us that we found ourselves in a situation of home office, homeschooling. So everything has to be done at home. And so we asked fathers to talk about, in a very short movie, to talk about their situation, how they share care work, how they share the burden, and how they go on with this challenging situation. And the interesting thing about it was that we really got, we got some videos where men really said, okay, this is the first time in my life that I spent that much time with my children, and I really like it. So we made a 5 minutes video, and we would like to share with you now the 2 minutes where fathers talk about their situation. Okay, thank you.
Das ist sicher eine herausfordernde Zeit. Für Väter genauso wie für Mütter.
So, sorry, if you go on CC, you can choose the English subtitle. So here you are. Yeah, thank you very much.
Im gleichen Maße. Homeoffice, Homeschooling, Hausarbeiten. Die kann nicht mehr so viel ausgehen, die Kids sind immer daheim. Das kann schon mal stressig werden, aber ich glaube, wenn man sich das gut einteilt und mit dem Partner oder der Partnerin immer gut abspricht, wann hat man Zeit für sich selbst, wann hat man Zeit für die Beziehung, wann hat man Zeit für die Kids, dass man sich das gut einteilt und dann auch die Zeit, die man mit den Kids verbringt, sich bewusst macht, dass es eine Zeit ist, die einfach nicht mehr kommen wird. Das ist eine exklusive Zeit. Und so viel Zeit mit den Kids zu verbringen, ist ja auch was Schönes. Weil irgendwann kommt dann eh wieder der Arbeitsalltag. Dann ist man vielleicht eh wieder eingespannt von 9 bis 5 Uhr mit der Arbeit. Dann kommt man heim und die Kids schlafen eh schon. Und das könnte man jetzt eigentlich, oder das tun wir zumindest, oder ich versuche das auszunützen, ja, und zu sagen, okay, wie viel Zeit, so viel Zeit als möglich mit meiner Tochter zu verbringen.
Ja, von unseren 8 Kindern waren in der Corona-Zeit noch 5 Jugendliche und ein Kindergartenkind, größtenteils zu Hause. Und das war natürlich eine spezielle Herausforderung, dann die ganze Haushaltsarbeit möglichst gerecht aufzuteilen. Das ist uns nach anfänglichen Diskussionen dann doch ganz gut gelungen mit so einem Wochenrotationsplan. Auf der anderen Seite war es aber auch sehr schön, nicht nur gemeinsam zu arbeiten, aber auch gemeinsam Spieleabende, Fernsehabende und Gesprächsabende und Mahlzeiten zu genießen. Insgesamt war es eine schöne Zeit.
Zu Pausen, zur Mittagspause, da tust du ein bisschen mit dem Kleinen spielen, ihn füttern und ja, man baut mit dem Kind einfach eine andere Bindung auf während der Zeit. Ich sehe darin keine Herausforderung, wenn man die Arbeit strikt trennt vom Privaten.
Kinderbetreuung zu Hause bei uns, ja, in Corona-Zeit funktioniert mehr oder weniger gut und die Kinder spielen im Garten und in der Wohnung und sie haben auch ihre Spielzeuge neu entdeckt. Ja, tagesstrukturmäßig ist eine große Herausforderung und wir versuchen mal diese Tagesstruktur richtig wieder neu aufbauen. Ja, aber allgemein, wir haben viel Zeit miteinander. Ich freue mich. Danke.
Thank you so much for this great video. And now I'd like to ask Vilana to tell us a little bit about the short animation we're going to watch. This animation is part of our European Parent campaign. And thank you, Lithuania, for in this final stage of the project having the energy to carry out this production.
Thank you very much, Tatiana. Well, yes, we were also in the lockdown and we were thinking maybe like to create something positive and something that, you know, would encourage fathers more engaging in the parenthood. And then we decided to like challenge stereotypes that, you know, the caring is not only a mother's issue, but fathers are very important in this issue. So like breaking stereotype was the main background or basis for the campaign or for the animation that we created. And it proved also very popular in Lithuania because we had more than 6,000 those shares and likes and watches. So we were very happy that people somehow took our message, and we hope that, you know, spreading more this positive message would also have a certain kind of ongoing change in changing stereotypes, which are very much spread still in our societies. So we can, yeah, and it is short, that 1 minute and 30 seconds.
hours a day and childcare is a woman's mission. She is inspired by nurturing and caring 24 hours a day and 7 days a week. A man won't get this. His job is to drag the prey home. No way! A mother's love is special, but the father is just as important to the child. He can recognize and respond to the baby's emotions, its needs, make it feel safe, and encourage to explore the world. When fathers are active carers, their children acquire better cognitive, linguistic, and emotional skills, higher self-esteem, fewer behavioral problems, are happier, more curious, and sociable. They cope with stress better, have more empathy, and a stronger sense of self. And above all, such fathers make children feel loved. The more time men spend with their children, the more confident they feel as fathers. They deal with anxiety and difficulties more easily and feel greater satisfaction with parenting. They become more active in their community and have more successful careers. Active fathers are strong on the outside and gentle on the inside. Let's not discourage men from becoming good fathers.
Thank you so much. I think this was the perfect sum up of all our presentations. And when we only have 1 minute and a half to explain someone why working on caregiving and engaged fatherhood is important, we have this short animation that I think it's really, really beautiful. I think that from the YouTube streaming, we don't have properly like questions and answers. Perhaps only a few last words. Looking at all of you, I'm feeling quite emotional and excited about this almost end of the project. The project ends formally tomorrow, but we know that as a team, as a consortium, we still have lots of work to do during the next 2 months. I think that we've shared so many experiences and lessons learned today, and we still have other lessons learned and experience to be shared. We will launch our national manuals. We will have our European manual on the website. We will have all the videos, animations, campaigns also on the website for those who are interested and want to learn more about our work. We want, of course, to acknowledge the huge amount of work time, effort, and creativity during these last 2 years and a half, especially during the last year and a half affected by COVID-19 and all the Plan B, C, and D carried by each team. And I think we need to assure that the work keeps going, and the specialists and policymakers and colleagues engaged today and during the project, I think their words were in that sense. We need to make parent and our approaches sustainable, and above all, I think we need to contribute to avoid backlashes in gender equality, backlashes caused by the pandemics and all the political answers, and to avoid backlashes in feminist achievements made until today. So I think we have a lot of work to be done, but this is a starting point. Thank you all who joined us on YouTube. The presentation will be made online, and I want to ask my colleagues if you have anything to add. Just go ahead. Now it's the informal part. It's being mainstreamed, but it's okay. We can celebrate.
I think I'd just like to say how wonderful it has been to be working with a team across countries. It's so stimulating. It's so enriching. And I do hope there will be further opportunities to continue this collaboration. It's been wonderful experience for us, although it's been difficult, costly. A lot of volunteer unpaid work has gone into this from all our partners as well, not just from us, but it was well worth it. And thank you all very much.
Yeah, I also would like to say a few sentences. Yeah, thank you very much for this great cooperation, and I hope that we will be able to continue our work together on the issue of active fatherhood and gender-based violence prevention, because I think on the European level it's an important issue to focus on the role of men. So also from our side, thank you to the Italian partner, thank you to Lithuania. And thank you to Portugal, and also to the partners who supported the project and co-financed it in Austria, the city of Graz and the province of Styria and the European Union. Thank you very much.
Yeah, I think, well, it's pity that, I mean, it's difficult even to think that it is over. That's it. Because it seems that just started, and well, it's pity that COVID situation disrupted our plans, and we could not meet more frequently, though we met online, but this is different. But I hope that we will have possibilities to work together and maybe some other projects, because the topic, as Ellie told, it's very important, and the solutions for the prevention of domestic violence should be very innovative and creative, and it cannot stop with one project. I mean, it should be ongoing. So thank you very much for everybody for your support and cooperation. Thank you.
Yeah, thank you also from my side. Thank you to you all. Knowing your story and mixing our views and our coming together to do this project has been a huge gift that has enhanced our ability to tackle the topic of gender-based violence prevention and fostering gender equality. And we are still improving and building our home with programs for perpetrators, and the Parent Project has been very inspiring in my personal experience. So thank you.
Linda?
Well, there's not much to say now, just a huge thank you to you all, and to all the people that are not here, but obviously all our consultants, all our partners and specialists that helped us along the way to design the programs and to help us to go over all the challenges that we had. And so to all those people that we don't have the time to say the name of all of them, but I want to say a huge, huge thank you for all the hard work, all the dedication, and for letting us know that we are plenty of people trying to achieve gender equality, and this can give us the strength to keep going with our work.
And sorry, I want to say a special thanks to Tatiana, because she's been the mind behind all this, the driving force. And I remember I sought her out a few years ago on the suggestion of Michael Kaufman and our colleagues from Men Care, and we spoke at length, and then we met again at Brussels, and then this whole collaboration developed. And so thank you, Tatiana. Thank you very much.
Thank you. And last but not least, behind the scenes, to Tiago, who's been with us dealing with all the logistics, technical parts and reports. Thank you so much, Tiago, and thank you, everybody.
And
we'll see you soon.
Luisa?
Luisa?
Yes. Hi, and in the name of the nursing school, we want to thank to you all for the opportunity to work with you and to work in this wonderful project. Thank you.
Thank you, Luisa. Thank you all. And we'll see each other very soon online.
Stay safe.
Stay safe.